A pharmacist administers a dose of a COVID-19 vaccine to a worker at a processing plant in Arkansas City, CAN, on March 5. Researchers are concerned that vaccination rates in some rural communities may not keep up with urban rates. Doug Barrett, Bloomberg via Getty Images. Hide caption toggle caption. Doug Barrett, Bloomberg via Getty Images. A pharmacist administers a dose of a COVID-19 vaccine to a worker at a processing plant in Arkansas City, CAN, on March 5. Researchers are concerned that vaccination rates in some rural communities may not keep up with urban rates. Doug Barrett, Bloomberg via Getty Images. Chris Reimer had never heard of Leopold, Mo. When he found himself rushing down a winding, two-lane road toward the rural, 65-person community in February. Reimer, a social media manager in St. Louis, had made a split-second decision when he saw a local television reporter tweet about a 2,000-dose COVID-19 vaccination clinic opening to anyone after 3 p.m. that day. "I jumped in the car and started driving south," Reimer says, though the clinic was 2 hours away in Leopold. "I definitely saw other cars on the interstate highway, and thought to myself, I wonder if they're going the same place I am. Because we were all driving perhaps a little too quickly." Reimer arrived just before the clinic's 5 p.m. cutoff time, and says he was thrilled when National Guardsmen running the clinic filled out his vaccine card. "This is really happening. I am getting the vaccine," he recalls thinking, along with a pang of guilt. At 50 years old, Reimer didn't belong to any priority groups eligible for vaccination at that time in Missouri. The Bollinger County Health Center, which put on the event with the National Guard, considered it a success, though over 1,000 doses went unused at that day's clinic, and others went to urbanites like Reimer, willing to make a long drive to get their shot. Early in the vaccine rollout, advocacy groups like the National Rural Health Association urged states to focus more resources toward rural areas like Leopold, which generally have older, less healthy populations and fewer healthcare options. And some rural communities have done well, with COVID-19 vaccination rates that equal or exceed urban communities in their states. But an NPR analysis of county-level vaccination data from the Centers for Disease Control and Prevention shows signs of an emerging rural-urban divide. When looking at vaccination rates of all adults 18 and older, rural counties appear to have largely kept pace with their urban counterparts, with rural rates on average landing within 5 percentage points of urban rates in most states. However, among people who are 65 years old or older, the gap between rural and urban counties is wider in most states. Urban counties' vaccination rates outpace rural ones in all but 7 states for which there's complete data. In 17 states, urban rates exceed rural rates by 5 or more percentage points. Loading.